This is an ultrasound study of a female pelvis, age 27 years, unmarried, with swelling of the abdomen. History is that she says that she has noted the swelling just 3 days back, sudden, and this was a sudden happening with beta ICG normal. And I'm going to perform this ultrasound with 3.5 megahertz per linear and with a transabdominal approach. So I have fixed this area because to show you that this is the urinary bladder in the longitudinal section, and this is the longitudinal section of the uterus. Now the uterus, this is the fundus of the uterus, this area. This is the fundus of the uterus, and this is the endometrial canal. So the outer border of the uterus is this one, where I am moving the cursor. This is the posterior border. This is the fundus. Here the anterior border is elevated, and here it is. Now this is the vagina, this line, you see, and this is the cervix, this box-shaped area, this cervical canal, and this follows into the endometrial canal that measures 9.5, meaning thereby she is in proliferative phase. So the uterus, this is the fundal area. Fundal region measures 7.6 into 3.3 centimeters, and the uterus is normal in dimensions, as you know that in our community, as per the height of the general height of the population, we take 11 centimeters in length and 5 centimeters in anterior posterior diameter as normal. So this is the longitudinal section. Now there is an area, this is the uterus, longitudinal section, when this is the urinary bladder. You are seeing, okay, let's first see the endometrial canal. This is the endometrial canal. Okay. And now this area that is being elevated and indenting into the urinary bladder wall, this area is the subserosal fibroid, indenting into the urinary bladder wall from the anterior wall of the uterus. That's why you are not seeing the uterine wall with clarity, straight. Now the subserosal fibroid measures 27.2 millimeters in length and 16.7 centimeters in anterior posterior diameter. So this is a subserosal fibroid from the anterior wall, anterior myometrium, indenting into the urinary bladder wall. So this is subserosal. There is no focal lium related to the posterior myometrium. Cervix is normal and the fundus is normal. Okay. This is the cervix. This is the endometrial canal. subserosal fibroid indenting into the urinary bladder wall. This is the urinary bladder. It's indenting, and this is a hypochoric area, solid, with no posterior wall enhancement or shadowing. This is the fibroid, interior wall, subserosal. Now we do get the fundus of the uterus with a bit difficulty. With the reason is that I'm going to show you why that there is, as I am moving the probe, this is the urinary bladder. I am going to now move the probe capillary towards the patient's head, and you will see this is the transverse of the uterus. This is the transverse section of the uterus, and now I am going to move the probe even further upwards, totally up to the capillary, and I see a large cystic area. Now you see this cystic area is thin walled, number one. It is full of internal echoes. These sand-like areas or particles, these are called the internal echoes. There are multiple islands of echogenic areas that do not give any posterior shadowing. This is the echogenic area, this one, this is the echogenic area. And there are dependent regions, rather with the posterior wall you see these solid echogenic area. These are solid areas. This is, I am at the umbilical region. Now here I am at the epigastric region. So it can be traced in the midline from the epigastric region up to the pelvic region. That was transferred. This is longitudinal section, and it is expanding on both sides of the midline. I am showing you now on both sides of the midline. But I have a filthy neck. So I can see the cyst from in this position from the epigastric region, this area, down. Here I see the cyst, here I see the cyst, and here I see the cyst. Longitudinally, I was showing you the cyst is present up to this region. Then when I move the probe towards the left side, it is seen up to, expanding up to the left flank, occupying all of the left side of the abdominal cavity and the right side of the abdominal cavity as well. So starting from here, now you see what I am seeing on the ultrasound from this region. This is the uterus. This is the uterus, boundary of the uterus, this one. Cervix, anterior wall, endometrial canal, posterior wall, and here is the cyst extending from the pelvic cavity. And then it is extending and expanding up to the epigastric region with numerous uncountable echogenic solid material seen within it. These are the solid areas within this. Now you see these are bands of echogenic areas or islands of echogenic area This is an island of echogenic area. None of these is giving any posterior shadowing, and this is total cyst. There is no calcification within the cyst. And these solid areas are also seen with the posterior lateral walls of this cystic mass. So this is a large cystic mass with islands of internal echogenic areas. A lot of debris seen within it. This is all debris, that sand-like area that you are seeing within the cyst. In white cyst, it's not unusual to see reverberation artifacts. So, in this case, I am not so far seeing them. However, you see this area is not clear. It could be as black as this if there had been no internal echoes. Now these are echoes. These sand-like areas. This is all echoes. This is not black. It should have been black like this had it been clear. The fluid had been clear. This is blue, and these are the echoes, and these are the echogenic areas. These are the echogenic areas. Okay. Now, does this cyst give any posterior acoustic enhancement? Is in front of you. We see a dense echogenic area behind this is. This is the acoustic enhancement, which again goes in favor of a cystic mass. As such, no fluid is seen in the pelvic cavity. We saw in the transverse and longitudinal section. It expands on both sides of the midline, extending from the right pelvic cavity, and let's see if it gives any mass effect on the kidney, on the ureter. If it gives a mass effect on the ureter, we will see hydronephrosis. Here you see, this is the left kidney, and you can see the dilation of the calyces. I have magnified it, the view. This is the kidney. Not a clear view, however, it's just to show you that all the calyces are dilated. There is minimal ectasia because of the mass effect from this large cystic mass. Let's see the right kidney. There is, you can see that, this is, again you can see that there is hydronephrosis. This is the right kidney, this area, and these are the minimally dilated calyces. So, otherwise the kidney is normal. This is the gallbladder. So this mass does not relate to the kidneys. The masala hepatosal acidity does not relate to the gallbladder, kidney, and this is the pancreas. This is the band of the pancreas. So it's not relating to the pancreas. So is the spleen. This is the left hemic diaphragm, part of the left hemic diaphragm, measuring 7.3 of normal to 12. So this is a case of ovarian cyst, large ovarian cyst with bleed. These are in fact clots. These are clots within this large cystic area or bleed. That rather bleed with clot, because this sand-like particles that you are seeing is the part that is fresh blood. This represents this echogenicity, sand-like particles within this cyst represent the fresh bleed, whereas this is the bleed converting into clots scattered throughout the cystic area.